ACLS. Ayan, I'll be presenting also kung ano yung mga dapat nating ituro. Let's say, dati kasi nawala po si lidocaine, na nawala. Tapos biglang binalik po nila ng 2020 guidelines ni AHA. And then the same pa rin po no, sa protocols ng COVID po, meron din. Mamaya i-share po natin yan. Alright? Now, when we say ACLS naman, medyo serious topic po ito as compared kanina na BLS. Of course, kasi ang BLS kasi medyo chill lang siya ng konti. Pero pag ACLS na po, in-depth na po ang mga gagamitin natin ng mga terms. Na, pero for sure, na syempre hindi tayo bago sa mga terms na to. Na minsan lang, yung iba po ay balik loob na sa kanilang profession. Yung iba balik loob na po sa hospital, 'di ba? Kaya medyo ayan, parang new ata to yung term na to. Na sige. So again, sa mga bago po, kakapasok lang ng ACLS, I'm Mark Adlawan, I'm from Davao City. I've been an instructor na for AHA and for ASHI for almost 10 years now. I love Philippines, kaya hindi mo na ako mag-abroad. Ayan, siguro yung passion ko to teach talaga na as an instructor, as a lecturer, as a teacher na yeah. Nandun na talaga sa heart ko. Kaya parang ayoko munang mag-abroad. Okay, sige. So we have the objectives. Now for the objectives kasi, we're going to teach na of course the basic and partly may mga i-discuss din po tayo na advance, okay, ECG and pharma. Ayan, of course, we need to discuss the members of the team kasi meron tayong mga tinatawag na the Code Blue team. Now, for bigger hospitals po, pag sinabi natin Code Blue team, majority mga doctors po yan. Pero pag sinabi natin mga provincial hospitals, let's say kulang po tayo sa doctor, so doon na po, no, mostly sa member po ay mga majority ng members natin, nurses, na, and then yung iba, staff or let's say yung iba, may mga nakikita talaga ako, but may mga naririnig din ako na pwede din po na sumali sa kanila sila nursing aid na ayan, depende sa hospital. Pero ideally, ayan, usually doctors and nurses talaga dapat. Kasi sila yung nag-training din 'di ba po? Ayan, para ma-revive talaga natin ang patient natin. May kanya-kanya talaga tayong roles na sa hospital po natin. Okay po? Ayan, sige. Now, let's go back sa anatomy, na anatomy of the said heart. Ayan, hindi na po natin di-discuss yung mga internal view, external view, but our focus will be the conduction of the heart. So we have the coronary arteries, 'di ba, the veins po natin. And my focus will be more of the polarization. Kasi guys, when we say polarization, sige nga sabay-sabay tayo. Everybody say polarization.
Polarization.
Thank you po na ayan. Salamat sa cooperation. Minsan gusto ko rin yung boses ng mga estudyante ko. Although duty, 'di ba? Iba busy, 'di ba? Ko talaga. Pag everybody say polarization, participate, bagsak agad sa akin. Ganun ako ka-stricta na CI. Na ayaw mo palang mag-cooperate. Pero estudyante, pag sinabi kung everybody say ready state, 100%. Kasi hindi ka nag-participate, baka natulog ka dyan. And medyo toxic ako ngayon na clinical instructor. Kasi guys, kasi pag online, lalo na sa fundamentals namin, kasi video talaga na minsan nagpapa-video talaga kami yung nagde-demonstrate na and yun po. Minsan ang dami kasi mga ngayon mga excuses ng mga estudyante. Na majority talaga ng mga estudyante ngayon guys, na like first year, ang daming tamad po. Iba ang mga estudyante ngayon compared sa atin na time. Char. Parang ang tanda ko na, no? I'm 34 and I'm single and virgin. Na yun yung importante, yung virgin. As in, grabe ang mga estudyante ngayon. Sobrang, ewan ko ba, if applicable ba yung term na weak, no? As compared sa atin na, yes ma'am, no?
Batch ka ng college? 2007?
Ako 2008 ako, ma'am. Sa atin na time kasi, ma'am, 'di ba, yung parang strong talaga tayo. Like pag may problem sa school, nilalabanan natin. Pero ngayon, guys, Like magulat ka na lang, no? Bigla nang biglang uupo ang parent, tapos biglang napagod na po yung anak ko, ganun, ay, Diyos ko Lord. Ba't parang kasalanan pa namin, no? As a teacher, ang weird lang talaga. Iba ang estudyante ngayon. Like, good luck na lang talaga sa amin na CIs. Bawal silang pagalitan, na like bawal. Kasi biglang-biglang, 'di ba? Mag-shift agad, na ewan ko ba? Ay, Diyos ko, iba talaga ang nila, generation ngayon. So I hope, yeah, kung may mga anak man kayo, and dapat i-train natin sila maging stronger, na? And dapat fighter agad, na yung iba kasi pag nagka-problema lang, Diyos ko, stop agad ng nursing. Ayaw naman namin na mag-stop kasi walang estudyante, wala din kaming work. And just to tell you din, just to share it with you guys, ang first year po ngayon sa school po namin, kasi it's the #1 nursing school here in Mindanao, which is San Pedro College, na umabot na po kami ng 1,000 students for the first year. So meaning dumadami talaga. No? As in booming na naman ang nursing po. So anytime soon, booming na naman ang mga training centers, ang mga review centers. So sa mga gustong ayan, we have the polarization. So again guys, pag sinabi natin polarization, it's the ready state, whether you want to work or whether you want to relax. Kasi may mga tinatawag tayong repolarization. Meron tayong mga tinatawag na depolarization. Now, pag sinabi po natin, ayan, depolarization, from the word itself, depolarize, ayan, we need to work. Now, we need to contract. It's a form of stimulation. Okay po? Stimulation meaning to say nagko-contract po. Kaya pag sinabi kong mga atrial depolarization, ventricular depolarization, and what I'm trying to say is that of course, no, nag-work po sila, nagko-contract po sila. Now, pag sinabi natin, okay, repolarization naman, ayan, so we have the repolarization. So guys, walang problema sa akin if hindi ka magsusulat, na pwede kayong mag-listen, pero yeah, for me, maganda din pag magsulat ka. Although magbibigay talaga kami ng recorded video, na nare-record kasi to. Ayan, so makikita nyo always yung mukha ko doon sa record. Ayan, we have the repolarization. Ayan, for the repolarization po, we have the word recovery. Diba, repo, relax, na magre-relax po yung heart po natin. Let's say pag sinabi kong atrial repolarization, ventricular repolarization, that means magre-relax sa atria at magre-relax din po ang tinatawag na ventricle po natin. Okay? So again, ano yung term natin? It's our sinabing depo, that means contraction. Alright? Why? Kasi sir, ganito, if we're going to analyze ECG, ayan, here are the steps kasi to analyze ECG. Number 1, what are the steps in analyzing ECG? Number 1, we need to tell me the heart rate of the patient. Check. Next, we have the rhythm. Ayan. Kamusta ang rhythm? Next, we have the P wave ng patient po natin. Kamusta ang P wave niya? Next, we have the QRS complex of the patient, or let's say ng ECG. Now, when we say, okay, heart rate, guys, I want you to memorize this. So we have the 300, 150, 100, 75, 60, 50, 40, 30, 20, and then 10. So again, i-memorize natin by heart, 300, 150, 100, 75, 60, 50, 40, 30, 20, and then 10. That's for the heart rate of the patient. Now, if I'm going to ask you, what's the normal heart rate ba? Anyone from the group? What's the normal heart rate? The normal heart rate should be 60 to 100. Tama po ba? Pag less than 60, guys, ano nga yung term natin? It's letter B. It's bradycardia. Do not say bradycardia. You say bradycardia. Kasi based on America tayo eh. 'Di ba? Dapat maarte tayo. Right? Ayan, no? It should be bradycardia. Sige nga, sabay-sabay tayo. Everybody say bradycardia.
Bradycardia.
Ayan. Pag greater than 100, anong term natin? So we have the word tachy. Ayan, cardia. Wala namang word na tachycardia, arte. Na? Ayan, so we have the bradycardia pag masyadong mabagal. Na? And then pag masyadong mabilis naman po, we have the word tachycardia. Ayan. Any form, 'di ba, of irregularities, any form, whether sobrang mabilis ba or sobrang mabagal, mga abnormal abnormalities na po yan. Okay po? Ayan, so we have the heart rate. Ayan, next to heart rate, guys, we have the rhythm. Ayan. So rhythm kasi natin, if, okay, the same po, ayan, if the same po ang rhythm niya, ang tawag doon regular. Pero pag not the same, ayan, not the same naman po, then, okay, ang tawag natin doon, okay, it's irregular. Not the same. Ayan, malamang it's, okay, irregular. Sir, paano ko ba malalaman no, ang rhythm ng patient? You measure the distance. Ayan, you check the distance between the P is to P wave and then the R is to R wave. Okay po? I-check natin ang distance between the P is to P and then the R is to R. If the same ang distance nila, then check it's regular. Pero pag hindi po the same, ang tawag doon irregular. Now, the proper term there should be arrhythmia. Okay po? It's arrhythmia or dysrhythmia. Pag hindi po the same ang kanilang distance. Mamaya ipapakita ko ang mga heart rate, ang rhythm po nila. Now, aside from the rhythm, guys, ayan, we have the P wave of the patient. Now, when we say P wave kasi, this will serve as the first name of the client. Or let's say ng ECG, tulad ng sinus, atrial, ventricular, first name yan. Lalo na pag malalaman po natin ang P wave ng patient. Example, if the P wave is clear and it's upright in nature, anong tawag natin doon? If the P wave is unclear and it's buried in nature, anong tawag natin doon? Aside sa clear and upright, unclear and buried in nature, ayan, we have the absent P wave. What if absent ang P wave natin or it's basically purely QRS? Or purely QRS po. Now, if that is clear and upright, if that's unclear or buried, and then if that's absent and purely QRS, may kanya-kanya kasi silang pangalan. Pag sinabi natin clear and upright, it's sinus. Ayan. Tapos what if bibigyan kita ng situation? The P wave is clear and upright. Sinus. However, the heart rate of the patient is 85, 'di ba? Pag sinabi kong 85, pasok po siya sa 60 to 100. So ang tawag doon normal sinus rhythm. Pero pag sinabi ko, the P wave is clear and upright, okay, sinus. However, the heart rate is 35. Anong tawag doon? Sinus Bradycardia. Okay po? So from the P wave, guys, ayan, you go directly also, balikan mo, okay, ang P wave niya naman is normal eh. So baka normal sinus rhythm yun. Pero pag less than, okay, 60, malamang it's bradycardia. So it's sinus bradycardia. Pag greater than 100 naman, ang tawag natin doon, sinus tachycardia. However, may limit kasi si sinus natin. May limit po na, ayan, lalo na if that's unclear and buried, guys, ang tawag natin doon, it's atrial problem. Alam niyo ba malalaman mo pag atrial, pag greater than 150 beats per minute na po ang what? Ang heart rate ng patient natin. Situation. The heart rate of the patient is 175. Poof! Hindi na siya malamang sinus kasi it's above 115. And then the P waves are unclear and buried. Anong tawag natin? Atrial tachycardia. Also known as yung mga supraventricular tachycardia or the SVT, the narrow complex tachycardia. Mamaya, madidiscuss po yan isa-isa. Next, guys, we have the absent. What if absent ang P wave ko? Ayan. Tapos, what if it's purely QRS? Guys, this is the most, okay, the fatal one, the deadliest one. Ang tawag natin dito, the ventricular arrhythmias. The ventricular, arrhythmias. Guys, when I say ventricular arrhythmias, example, ventricular fibrillation, ventricular tachycardia, whether if it's pulseless or with pulse. Yun na yung mga nakakatakot. Sige, try natin i-apply, guys, ha. May technique ako, mabilis lang to. Ayan, kahit hindi ka nakatingin sa ECG, what if magre-report lang ako sa'yo? The heart rate of the patient is 40. And then the P waves of the patient is clear and upright. Anong tawag natin? Sinus bradycardia. Tama? What if bibigyan kita ng situation? Ma'am, doc, nurse, ang patient kasi natin po is having a heart rate of 110. And the P waves are clear and upright. Anong tawag doon? Sinus Tachycardia. Okay? Basta tandaan nyo lang yung 60 to 100. Pag within 60 to 100, normal heart rate po natin yan. Less than 60, bradycardia. Greater than 100, it's tachycardia. And tignan mo din ang ating P waves, if that's clear and upright. Listen carefully. Sir, the heart rate of the patient is 175. And then the P wave is what? No, unclear. And they are buried in nature. Nakalagay, unclear and buried. So, ang tawag natin doon, atrial tachycardia. Alright? So, balikan natin ang heart rate. And then you focus din sa P wave. Para malaman natin whether if it's sinus, whether if it's an atrial problem, or whether if it's what? No, purely ventricular problem. So, ano yung nakakatakot? Malamang it's the ventricular problem. Diyos ko. Ayan, kasi pag ventricular problem, guys, this means what? Na yung mga, ayan, sudden cardiac, okay, death experience na kasi ang nangyayari dito. Now, aside from P-wave po, we have here the QRS complex. Ayan, so we have here the QRS. Now, pag sinabi po natin QRS complex, you tell me if it's narrowed. No? Tell me if it's normal. And then you tell me also if it's widened in nature. Pag sinabi nating normal, edi normal. Na? Pag sinabi nating narrowed, okay, baka may SVT ang patient natin. Or the supraventricular tachycardia. Pag widened naman po, baka may, okay, VTAC ang patient natin or ventricular tachycardia. Guys, if you're familiar with SVT, na? Your SVT kasi it's the supraventricular, ayan, tachycardia. So, pag nasa Manila ka, ayan, they call that one as the supraventricular tachycardia. Kasi yung pinaka-head na superintendent po kasi ng AHA, ayaw niya na pina-pronounce namin siya ng supra. It should be supra daw talaga. Like supraventricular. Tulad pala ng ng pagka-pronounce ng Supreme Court, dapat pala Supreme Court. Na ideally it should be Supreme Court. Ayan, ay matanong ko lang, Doc Yu, ayan, Doc Yu, saan po tayo nag-work, Doc Yu? Naka-mute ata si Doc Yu. Or baka nag-duty si Doc Yu, sorry po. Ayan, how about si Doc Batong, saan po nag-work? Isang hospital lang kayo parang wala sila. I'd like to ask, sino po dito ang nag-work sa sa BRT? Meron po ba? Meron po? Beshi Sara. Ako pala si Angeline Quinto, na ikaw si Sarah G. Ayan, saan ka nag-work, ma'am? Hindi pa nag-work. Ganun talaga, ma'am, pag mga pensionada, mga
Papa. Nasa Joseph.
okay. Hello kay Papa mo, ma'am. Ma'am, baka naiingayan na si Papa mo sa akin, ma'am. Dapat kasi nag-headset ka, ma'am.
Okay.
Sorry naman kay Father mo kung masyado akong maingay. Ikaw ang ma'am? Ikaw ang private duty nurse ni Papa mo? Okay, ayan. Sige, no? So, get well soon din kay Father. Ayan. Thank you, ma'am. Ayan, sige po. So, ayun, no? Pag sinabi po natin kay SVT, guys, that's the supraventricular tachycardia or the SVT or the narrow complex tachycardia. Meron po ba dito ang nag-work sa Tanshuling? Meron po ba? Wala naman siguro, no? Ayan, baka kasi kung meron at baka nakikinig din si X, charot. Ayan, hindi. Wala lang. No? Hindi, naman, no? Good naman. No? Yeah, hindi naman kami nag-uusap, pero for sure naman okay naman. Siguro, feeling ko. Hindi rin ako sure. Ayan. So, ayun po. Na-miss ko lang mga pagkain dyan. Na-miss ko talaga. And the view ng SM nyo, guys, whenever we park at the roof deck. Roof deck ba tawag doon? O basta, pinakataas ng SM, like, di ba, the view. And then the view din ng Camellia, kasi sa Camellia kasi siya. Pero ayoko lang talaga sa Camellia, guys, sa Legazpi, di ba? Kasi pag may bagyo, Diyos ko Lord. Parang mga kamelya talaga ang unang mawawasak no, sa Alba, sa Legazpi. Like, sobrang nakakatakot dyan. Ayan. Sige po. So, we have the QRS, okay, complex. Now, once again, no, paano nga ulit mag-analyze ng ECG? You tell me the heart rate. Memorize natin yan. Next, we have the rhythm. Next, we have the P wave. And then lastly, we have the QRS, okay, complex po natin. Ayan, whether if it's normal, whether if it's okay narrowed, okay, whether if it's okay widened in nature. Okay po? Ayan, now, let's advance na sa ating okay lecture po for a while. Ba't parang hindi ko siya maano? Ayan. So we have the conduction system of the heart. Now, pag sinabi kasi natin conduction system of the heart, my mnemonic will be the sublurb. Bakit siya sublurb? Letter S, letter A, letter B, letter L, letter R, letter P. Ito lang yun, no? Si sublurb po natin. Now, letter A stands for the SA node. Next, we have the AV node. Next, we have the bundle of His. Left and right, okay, bundle branches. Ito, bundle branches, bundle branches. And then we have the Purkinje fiber. Guys, ito lang yan ha. Sila lang yan. Now, ganito ang technique natin. Pag sinabi po natin SA node, this is the primary pacemaker. Next, pag sinabi natin okay, AV node, this is your okay, the secondary okay, pacemaker po natin. This is where the secondary. Ayan, pag sinabi po natin primary, dito pala natin makikita si firing rate na 60 to 100. Okay, normal. Pero pag nasira na po ang SA node mo at si AV node na ang magte-take over po, ayan, you will be experiencing bradycardia. Why? Because the firing rate of your AV node will be 40 to 60. Tama po? And then pag sinabi natin, okay, Purkinje fiber guys, mas worse. Kasi magiging 20 to 40 beats per minute. Meaning to say, these are the firing rate or the heart rate ni patient po. So we have the SA node, we have the AV node, and then we have the Purkinje fiber. So careful lang po tayo dito. Okay? Ayan, so dapat alagaan talaga ang heart natin. Kasi pag si AV node na lang magpa-function, di ba kaya pala may tinatawag na AV block. Di ba? May mga first degree, second degree AV block, third degree, known as the complete heart block. Kasi tignan mo naman sa AV node, bradycardic na si client pag siya na lang po ang nagfa-function. Alright? So we have the conduction system, alagaan ng heart. Char, nagsalita ang healthy. Siyempre, ano bang mas masarap? Kangkong or crispy pata? Siyempre, crispy pata. No? Ano bang masarap? Lechon or pinakbet? Pwedeng i-combine. pag medyo iw na ang lechon, why not, 'di ba? Magpakbet na din, no? Tapos, ay Diyos ko, sarap kaya no. Tapos may dinuguan, may kilawin. Sa Davao kasi guys, sikat talaga dito ang kinilaw. Ayan, for sure yung iba nagse-celebrate pa po no, sa kanilang Mother's Day. Balik na po tayo. Guys, balik na po tayo ha. Ano to? Ayan, sige po. Pero pag nag-duty naman, walang problema sa akin. Recorded naman to na ayan, sige. Pero kung estudyante ko pa to, pag hindi talaga sumasagot, bagsak na talaga sa akin. Pero dahil training to, syempre mabait ako, na. Ayan, sige po. So we have the conduction system na discuss na natin yan. All right. So we have the ECG. Now, for the said ECG, di porket yun ang sagot, or let's say yun yung nakikita natin sa ECG guys, ay yun na siya. Kailangan din natin i-evaluate na i-reassess din natin ang client. Kasi may mga moments na asystole na po, or nagkaroon ng asystole si client. Tapos, di ba, asystole si client, no? Tapos ikaw din, no, kailangan na ako mag-perform ng high quality chest compression kasi nag-asystole na. Pero yung patient nyo guys ay tumatawa pa, 'di ba? Grabe ka, nag-rely ka talaga na sa monitor. I-reassess mo na i-check mo talaga kung asystole ba talaga at tama ba talaga yung nakikita po natin sa monitor po natin. Okay po? Kasi di ba pag natanggal yung mga leads natin, ECG leads, expected po na nagfa-flatline talaga yan. And then para masabi mo na flatline talaga, make sure dapat walang pulso ang patient. So the patient should be pulseless in nature. Kasi if may pulso naman ang patient, guys, then you check po. Kasi baka nag-loose leads ang patient. Ayan. Ang electrodes po, yes, may video po tayo later dyan. Now, let's have the ECG paper. Now, for the ECG paper kasi, meron tayong mga tinatawag na big boxes, meron din tayong tinatawag na small boxes. Yung green guys, ang tawag ko dito, that's where the big box. Yung mga green po natin. Tapos, no, yung mga black na yung mga black, color black na idodraw ko, 1, 2, 3, 4, 5. These are okay the 5 small boxes. Okay? 5 small boxes. Ang green, ang tawag diyan big box. Ang mga black naman po, ayan, no, small boxes 'yan. Kaya nga 'di ba, ang isang big box daw corresponds to 0.20 seconds. Ayan. This corresponds to 0.20 seconds. Sir, bakit po siya naging 0.20 seconds? Kasi sa loob ng isang big box, meron po tayong mga small boxes. And this small boxes, okay, corresponds to 0.04. So 0.04 times 5, a total of 0.20 seconds. But wait guys, hindi naman ito ang focus natin ang mag-count ng boxes. Ang focus po natin ngayon is for us to analyze ECG in a matter of, okay what, no 3 seconds only. Yun yung goal po natin ha. Ayan, for a while. So ulitin ko, we have the 5 small boxes and then we have the 1 big box. So ang isang big box corresponds to 0.20 seconds. Sir, bakit po siya 0.20? Kasi sa loob ng isang big box, meron tayong small boxes which corresponds to 0.04. So 0.04 times 5, a total of 0.20 seconds. However, hindi po yan yung focus natin. Ito ang focus natin. So we have the positive, and then we have the negative, the flex po natin. Na? So yes, now we have the atrial depot. We have the ventricular depot, and then we have the ventricular repolarization. And then, okay, that means, okay, ayan, yung PQRST mo, P, Q, R, S, T. What if my U? Alam niyo ba ang U wave represents hypokalemia, and that represents a slow heart rate po, na babagal po, na babagal ang heart rate ng patient po natin. Ayan, gawa na lang ako ng arrow. Ayan, babagal ang heart rate pag may U-wave si patient. Because your U-wave kasi, it represents hypokalemia. And as we all know kasi, di ba, potassium, it adds contractility sa heart po natin. Na? Kaya pagbaba ang potassium, malamang bradycardic ang patient po natin. Don't worry guys, no? For this afternoon session, yan, we're gonna end the afternoon session at exactly 3 o'clock. Usually 3 o'clock tapos na na kasi for sure board na board lang diretso na natin to sir. Ang cute lang ni ma'am, sabi niya wala akong gagawin, diretso na natin to. Ever PQRST ma'am, may kumatos, may natutulog pa. Sabihan mo na lang si pwede mo ding sabihan si Father na mag-listen na lang din kasi CG naman to. So exciting yung topic, 'di ba? Ayan, sige po. So we have the PQRST. Ayan, pag sinabi po nating PQRST, your letter P kasi guys, your P wave po, it represents atrial depolarization. That means magko-contract ang atria. And again, P wave represents atrial contraction. Now, how about, sir, ganito? Whenever we contract, whenever we work kasi, we need to relax. Tama po? Siguro kung may pera lang ako, kung ako magre-relax, no? Kasi next month na po, wala na kaming work, no? And then, for 2 months, kasi di ba pag CI ka, Diyos ko, sana ako mamamokpok dito. Wala kasing work no? Kaya kinakabahan ako, saan kaya ako mapupunta nito, no? I hope na may mga trainings, etc. na, Diyos ko, kinakabahan ako. Promise. Ayan, if ever siguro kung may pera ako, tas na-stress ako, punta ako ng Siargao. Tas at least maghahanap ako ng mga AFAM doon. AFAM goals? If ever lang naman na, ayan. So we have the P-waves. Sawa na ako sa mga Bisaya. Ayan, gusto ko naman AFAM, na kawasak. And we have the QRS. Guys, pag sinabi po natin QRS naman, that represents dalawa. Makikita po natin Q, R, S. Your QRS, guys, represents dalawa. Ano yun sila, sir? Number 1, we have the atrial relaxation. Kasi nag-contract ka kanina eh, di ba? P-wave, nag-contract. So meaning, ang next po, QRS, magre-relax ang atrium mo. Kasi pag hindi po siya magre-relax, baka ma-stress po yung heart po natin. So kailangan mag-relax. And then, alam niyo ba, at PQRS, at QRS also, this is the start of the contraction of the ventricle. So habang nagre-relax ang atrium mo, this is the start of your ventricular contraction. Ayan, kasi pag relax lang, edi kamusta naman tayo, 'di ba? Ayan, magulat ka lang, naging bradycardic na tayo. So kailangan niyang mag-contract. Now, sa pag-contract na naman ng ventricles mo, we have the T wave here. And then your T wave po, that represents what? The relaxation of what we call as the ventricles. So again, anong nangyayari? Contract, relax, contract, relax. T wave, contract. QRS, okay, relax, and then magko-contract, and then T wave na naman po, magre-relax siya. So, ulitin ko, contraction, relaxation, contraction, relaxation. Kasi pag contract lang ng contract lang ng contract lang ng contract without relaxation, ayan, heart attack ang tawag doon. Na? And ayaw nating mangyari yon. Okay po? Although kasi the platform po, ako honestly, I'm really health conscious now, Char. Kakakain ko lang ng liempo, health conscious. Kakakain ko lang ng humba na pata, health conscious na. Kasi sa harap ko guys, may mga vitamin C, na meron din akong mga, alam mo na, thanks to healthy options like for the control of the sugar, no, tas may mga vitamin C. No, as you grow older na pala, as you age din na, like, yeah, kailangan mo mag-invest na din sa health na aside sa aside sa mga gamot, meron din akong peanut butter. Doon tayo sa peanut butter, guys. And then meron din akong mga bread na sa pakitang tao lang pala yung mga healthy na yon na ayan, meron akong pagkain, 'di ba? Ay, Diyos ko. Tapos meron nga akong 6 slices na of loaf. As in like, inubos ko talaga. Eh, ganun ako eh. Habang napiplay ng video, kumakain din. Nasanay na siguro ako. So we have the PQRST guys ha. Now, ayan. Sir, ito yon sila. So pag sinabi po natin, okay, PR interval, na, we have the point, okay, 12, okay, to 0.20 seconds, which is normal. And then we have the QRS which is okay, 0.10 seconds or less. Meron din tayong mga QT interval. Ayan. Ayan, no? So we have the okay, 38 din po, no? Like mga seconds po natin, 'di ba? Ayan. Pero hindi na 'yan yung focus natin kasi diretso na tayo eh, no? Ang mangyayari kasi later, i-show ko lang ha kung paano tayo mag-analyze ng rhythm. So guys, medyo maingay 'to. Medyo iano muna natin ang ating mga volume. This is the DART simulator, like the usual na nangyayari po sa hospital. Okay, if you are going to apply, no, yung sabi mo kanina, heart rate, rhythm, 'di ba? We have the P wave and then we have the QRS. Paano ba siya basahin? The heart rate is 70. The rhythm is regular. I can see P waves, they are clear and upright, followed by QRS, which is normal, okay, in nature. So therefore, the patient is, okay, having a normal sinus rhythm. Ayan, wait lang ha. Ayan, ito. Introduction lang. Okay. I-apply natin yung mga learnings natin kanina. Introduction lang to guys. Don't worry, yung iba nagpanic bigla. Bakit may mga ganito na? Ba't parang introduction pa lang yun? Ba't parang nag-analyze na? Hindi. Para at least na mag-grasp na po natin ganito pala yung format nila. Now, the heart rate is 38. The rhythm is regular. I can see P waves. They're clear and upright, followed by QRS, which is normal, okay, nature. So therefore, the patient is what? Na experiencing sinus bradycardia. Tignan mo naman ang heart rate, 38. It's less than, okay, 60. Okay po. What if ganito na? La. Okay. So guys, this is the pathognomonic sign na kung saan pag above 150 po yan, and usually 170, yan 'di ba? Sounds like 170 SVT na kasi sa mga hospital po, usually pag nag-170 na ang patient, alam ko na 'to, na 170, so it's about 150 na po, na. So malamang hindi na po siya sinus, malamang it's an atrial problem. Ayan, the rhythm, okay, is what? It's regular. The P waves are buried proceeding to T waves. So meaning to say, the P waves are unclear and they are buried. So may technique na tayo. And then you watch out also for the what? QRS because it's narrowed. Ayan. So anong tawag dito? It's the SVT, the supraventricular tachycardia or the atrial tachycardia. Okay po? Ayan, kung wala ka pong ginagawa dyan sa mga upuan nyo, pwede kayong mag-picture nito, tapos i-upload nyo sa Facebook. 'Di ba? Para sabihin ng friends nyo, ay, ang talino niya naman. No? Kasi sa kalagitnaan talaga ng pandemic, nag-a-attend talaga siya ng seminar. Amazing Earth. 'Di ba? Amazing na nurse, amazing na doctor. Nag-a-update talaga siya, o 'di ba? Plus pogi points 'yan sa atin at plus guwapa points 'yan sa inyo, na. Yun yung ginagawa ng mga estudyante ko eh. Sabi ko sige, picturean niyo 'to para sabihin ng sabihin ng ng mama niyo, no, ng aunties niyo na ang gagaling niyo na. Kahit wala kayong natututunan, charot. Basta ang importante may picture. Kasi ngayon picture na lang talaga eh, 'di ba? Kaya whenever I discuss po sa mga students ko, I usually write. I never use like mga PowerPoints. Ayoko. Kasi pag magpa-PowerPoint ka lang na magko-control F sila para makita nila mga tamang sagot. Let's say magki-quiz ka. Yan. Kaya uwag po, no, sa mga mag-aspire na mag-CI diyan. Ayan, wag magbigay ng mga ng mga PowerPoint sa kanila or else magchi-cheat lang talaga mga estudyante. Ang galing nila ngayon. Control F lang talaga ang sagot na para hindi po mabagsak, 'di ba? Like sa mga exams nila. For usually I use slides, no? Lalo na pag sa training, no? Lalo na pag sa ECG pharma kasi kailangan talaga makita ang picture kasi eh. Kung pwede lang, kung magaling lang ako mag-draw, why not, na? Sige, i-apply natin yung natin, yung learnings natin kanina. Now, how to check, 'di ba, for the heart rate of the patient. Now, to check for the heart rate of the patient po, ayan, we need to find or to look for a QRS. Maghanap ka daw ng QRS that falls on a straight line. Nasa ng straight line? Ito, straight line. Ito, straight. Ito, straight. Ito, straight. Ito, straight. So, maghahanap daw tayo. Ayan, up to the next QRS. Sige, maghanap ako ha. Ito, hindi. Ito, pwede to. Ito. Kasi nag-fall siya sa straight line, oh. Ayan, so pwede yan. So magka-count tayo up to the next QRS. Up to the next QRS. So up to dito tayo magka-count. Kasi andito yung QRS mo, oh. So up to dyan tayo magka-count, ha. Ayan, so dito ka mag-start. Ayan, up to dito. Pero hindi ka talaga dito mag-start like sa black. Up to the next QRS tayo. So dito tayo mag-start. 300. Ayan. $150, $100. Between 100 to 75. So, yes. 75 to 100 that falls on a straight line. So ito yon siya. Pero dito muna tayo magsa-start mag-count. 300, 150, 100, 75. Kasi ito yung next na QRS eh. So it's 100 to 75 which is normal ang heart rate ng patient natin. Don't worry. Medyo hindi pa siya clear sa part na to. Pero as we go along dito na part for a while. Okay. Maghanap tayo ng QRS that falls on a straight line. Ito pwede na ba to? Yes. Ito pwede? Yes, pwede. Up to here. Up to here. Kasi nandito yung QRS natin na isa. So, paano tayo mag-count? 300. So, this one is 300. 150, 100, 75, 60, 50, 40. Okay. It's ayan, between 50 to 40 or 40 to 50. Malamang guys, it's less than 16. So this is a what? An example of a bradycardic na patient po. Sige nga, pa-on nga ng mga cameras po natin, pa-on po ng mga videos. Baka kasi dalawa lang kami. Ayun. Hello po, ma'am. Hello po. To P, is to P, is to P. To P pa. Ayan. Tapos may P pa. The same bang distance? Yes. I-connect mo. Ay, walang problema, sir. The same po ang kanilang distance. So, ang tawag natin dito, it's regular. Okay po? Ayan, regular ang rhythm. Kahit wala tayong ruler. Baka yung iba kasi, sir, do I need to have a ruler? No. Kahit mata mo lang, di ba? Pag nakita mo na the same ang distance nila, ayan, ang tawag doon regular. What if, sir, walang P-wave si client? What if lang? Don't worry. My R is to R, 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 and then is to R. Connect mo. Pap, 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 pap. The same distance? Yes. Ang tawag doon, regular rhythm. Pero pag hindi na po the same yan, irregular ang rhythm. So meaning nagkaroon ng arrhythmia ang patient po natin. Okay. Ayan. Sige ha, eto. Tell me if it's regular or irregular. Let's have the moving ECG. Ayan, tell me if it's regular or irregular. Regular, irregular. Regular. Tama? The same ang distance po nila. So pag the same ang distance guys, regular ang tawag doon. Now next, what if ganito ang nakikita po natin? Regular pa rin yan, sir. Wag mong tignan yung height. Yung itayad, ang mo, superstar. Pag this regular, ito, ala, guys, ayan, ang tawag po natin dito, ayan, irregular na po. Dysrhythmic or arrhythmia. Yan, may arrhythmia ang patient po natin dito. Pero tignan mo, sir, may arrhythmia siya. Tapos normal naman ang kanyang heart rate. Yes, ang tawag natin dito, it's the sinus arrhythmia. Pero careful pa rin. This is actually manageable, no? As long as the patient can tolerate sinus arrhythmia, arrest lang kasi ang kailangan dito ng client. Pero kasi pag naging dysrhythmic na talaga, tas pangit pa ang kanyang heart rate, that's the time na po no, na kailangan na i-manage ang patient po natin. Alright? Ayan. Pero for some doctors kasi, pag may sinus arrhythmia ang patient na nila, ayan, minsan tinitreat na talaga, like mga lidocaine, no? Or let's say yung mga antidysrhythmic drugs such as mga procainamide, ayan, binibigyan na po sila. Depende sa doctor's order pa rin. Okay po. Ayan, sir, what if ganito ang nakikita po natin? Anong term natin dito? This is an example of a chaotic rhythm. Chaotic na siya, guys. Like, sobrang magulo na. The term there should be chaotic. Hindi siya irregular, hindi din siya regular. It's chaotic. In chaos na po siya. Why? Take note of the heart rate is 0. The rhythm is chaotic. There's no P wave here. There's no QRS. And 'di ba para siyang worm? Kasi ang client po natin, no, ay kakainin na siguro ng worm kasi this means a sudden cardiac death experience. So this is the what we call as the ventricular fibrillation. 'Di ba ito yung naririnig natin always. VFib, 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 code, okay, code agad. Nagko-code blue agad, in which ito yung pinakaayaw po natin. Okay po? Ayan. So again, ang tawag natin dyan, it's chaotic in nature. Now, first things first is that we need to go sa basic muna tayo. Ayan. Let's have, ito yung P-wave pala. Guys ha, para at least na, para mag-go na tayo sa ating mga topics. P-wave, P-wave, P-wave. Ang tawag dyan, clear and upright. Clear and upright. Ito naman yung sa QRS po natin. If that is widened, okay, this means, okay, nag-VTAC ang patient mo. If that's narrowed po, usually SVT. And then pag normal QRS, normal, no? Ang what? No, ang, pwedeng normal sinus rhythm, pero pwede ding sinus bradycardia, pwede rin pong sinus tachycardia, di ba? Ayan, so careful lang talaga tayo, guys, in determining, okay, the QRS complex of the patient. Now, let's proceed sa ating first topic. Now, for the first topic po, we have the sinus rhythm. And when we say, okay, sinus rhythm po, ayan, it's within the normal, okay, range po, or let's say ang kanyang, okay, heart rate, di ba? Walang problema po, guys, pag normal sinus rhythm. Pero ang sabi kasi ng American Heart Association, that doesn't mean na NSR ka, no, ay healthy ang patient. Kasi baka later din po, ayan, for a while. Sorry guys. May tao kasi eh. Yan ako lang kasi yung naiwan. Yun talaga yung problema natin na pag nag-online, tapos ikaw lang yung tao na sa bahay lang, tapos biglang may kumakatok na. Sorry po. Ayan, so we have the normal sinus rhythm. Again, ang sabi ng American Heart Association, ayan, so bawal maging kampante kasi di porket NSR yan, forever siya healthy. Ayan, yung iba kasi po, no, may mga patients po na MGH. Ano nga ibig sabihin ng MGH? May go home. Hindi po lahat ay may go home. Yung iba ay may go to heaven. No? Tapos si nurse naman ay hindi po nag-check ng mga vital signs, 'di ba? Yun yung sad part. So I hope po na kahit MGH po si patient po natin, kailangang i-monitor pa rin ang patient. Ma'am Sara, para hindi ka masyado ma-stress, don't worry ma'am, kasi may naman, may manual naman kayo na baka na-stress ka na, no? Kinopya mo talaga yan. Mas stress ka talaga ma'am. Nag-draw ka pa, no? Like, nag-draw ka pa ng mga lines.
Hindi naman.
Ay, okay, ma'am. No? Kasi gumagalaw kasi yung pen mo eh. Concern lang ako. Ayokong ma-stress ang mga estudyante ko. Pero pag hindi pa RN, gusto ko ma-stress sila. Pero pag mga RNs na, walang problema sa akin. Ang importante lang naman is that marinig niyo yung mga updates, tapos certificate. Tapos nag-upload kayo sa Facebook na nag-attend kayo ng training. Yun yung importante. Para sabihan nga, di ba? Na, ay, grabe siya. Ang talino na yan naman. Ang dami pang gawin, pero mas pinili niya mag-update. O, di ba? Mas bongga yon. Dagdag guwapa points. Ayan, we have the sinus rhythm. Now, aside from the sinus rhythm, we have the sinus bradycardia. Guys, pag sinabi po natin sinus bradycardia, the patient here, okay, is may dalawang letter A, which is really common naman po sa patient natin. Number 1, 2 patients who are athletes, hindi athlete's foot, di ba? Mga athlete po natin na patient, guys, yung mga mahilig mag-basketball, mahilig mag-agaw, di ba? Ayan, tas pag agaw, hindi na ibabalik, grabe siya, ayan, ibalik mo din, 'di ba? Kawawa naman yung bumuo, 'di ba? Ako yung nauna, pero siya ang wakas. I hate that song. No? Alam mo yung 10 years kayo, pero iba lang pala yung wakas. Ay, char. Di ba kamubunte? Yes, sa 10 years siguro, yes. Grabe kasi yung pinagdaanan talaga namin na ayan, pero yeah, may jowa din siya ngayon na doktor, pero feeling ko ayoko na din siguro bumalik sa kanya. Kasi parang feeling ko parang friends na lang talaga kami. 'Di ba may mga factor kasi na mga ganun. Na parang feeling mo na okay na, parang mas okay na ganito na lang. Kasi I cannot promise din my ano eh, may may loyalty. Ganun talaga pag maroropok, no? For the athlete. Next we have ang mga taong asleep, 'di ba? Ang mga taong tulog. Ayan. So we have the asleep. 'Di ba pag asleep kasi na ito yung ayan no, expected talaga. Normally po, this is normal. Sinus bradycardia is normal to athlete and then normal din sa mga taong tulog. Now, I have a question. Sino yung mahirap pong gisingin? Ang taong tulog or tulog-tulogan? For sure kayo lahat ay makaka-relate. 'Di ba? Yung mga kapatid po natin na, "Hoy, gising diyan." 'Di ba? Alam mo talagang tulog kasi parang biglang ba't mo ako ginising, 'di ba? Pero Diyos ko, may mga kapatid po tayo na, "Hoy, gising, gising, hoy, hoy." Parang 1 hour ka na lang, 'di ba? Kahit gaano mo siya sinuk, 'di ba? Like parang ayaw niya pa rin, na grabe siya. Mahirap talagang gisingin ang taong tulog-tulugan lang. So we have with the asleep, 'di ba? An athlete. And kasi 'di ba sa athlete din, napansin niyo ba? Patakbuhin niyo ng mga 2 kilometers ang mga sanay na po. Pag-check mo na sa kanilang mga heart rate ay baba pa rin, na sanay na kasi sila sa mga strenuous activity. Ako guys, try mong patakbuhin ng 2 kilometers. Siguro sa 1 kilometer pa lang nag-heart attack na ako. Alam mo yung hindi ka sanay sa mga gano'n na mga activity. Siguro sa 500 meters pa lang nag-V-feed na ako. So meaning sa 1 kilometer na stroke na pala ako, Diyos ko po. With the sinus, ayan, bradycardia. Ayan. So again, pag sinabi nating bradycardic client na, ayan, syempre ang heart rate niya is low. Slow. Di ba? Slow heart rate. Tignan mo naman, the heart rate here is less than 60 beats per minute. Okay. So this is the main problem here. Okay po? Siya ang pinaka-problema natin. Kaya siya tinawag na sinus bradycardia. Walang problema dito except for the heart rate of the patient. And it's the bradycardic, okay, or the bradycardia. Now, usually kasi paano ba siya minamanage na sa ward? If we have a pediatric clients, usually it's already epinephrine. Ayan, it's epinephrine ang binibigay pag pediatric. How about pag adult po na, let's say adult na with sinus bradycardia, it's the atropine sulfate. Ayan, atropine. Ayan, sulfate po ang binibigay. Again, ulitin ko. If that's your pediatric client, we usually give epinephrine. And then pag adult naman po, we usually give atropine sulfate, the 0.5 milligram. Ayan, sige lang, mag-discuss naman siya na as we go along sa ating topic na na mga mega code na po tayo. Magme-mega code. And so again we have the sinus bradycardia. Next po, we have the sinus arrhythmia. Guys, sabay-sabay nga tayo. Everybody say arrhythmia.
Arrhythmia.
Ayan. Thank you po. baka kasi dalawa lang tayo dito Siguro baka nag-duty sila, Doc. Baka nag-duty. Hello, Ma'am Karen. Ayan. Sige nga, i-check ko nga si Ma'am Karen. Hello po, Ma'am Karen. Pa-unmute na lang, Ma'am. Ma'am Karen. Lo. Oy, Wipam. Ba't parang wala mga estudyante? Hello, Ma'am Daphne. Daphne Jean. Kasi obvious andyan talaga si Sarah si Ma'am Sarah. Ayan, si Ma'am Saitus, of course, nakita ko si Ma'am Saitus kanina. Nakita ko din si Ma'am Catherine na, ayun, hello po. Hello, Ma'am Bernadette. Ayan, nahahappy ako pag nakikita ko yung mga estudyante. Hello, Ma'am. Ma'am, saan ka nag-duty ngayon, Ma'am?
Dialysis po, sir.
Sa dialysis.
Doktora Irenea Rodriguez.
Ay, yeah. Yes po. Yeah, ang dami na naming mga Sino nga yung isa? Ma'am, sino nga yung lalaki na may-ari din ng dialysis, ma'am? Yung magkapatid na mga doctors po? Si Doc, ano?
Sir Francis po.
Ay, yes. Tama. Doc Francis. Na, yan, naalala ko sila. Sila ba din may-ari dyan, ma'am? Or
Nurse
iba
po
din?
siya. Consultancy.
Okay.
Parang nagpa-franchise po sila.
Ay, nice, ma'am. Ayan, welcome, ma'am, no? Welcome to WePump. Ayan, kinamusta ko lang ang mga estudyante kasi ang nakikita ko always si Ma'am Sara. And pasample naman dyan ng ikot-ikot lang. Ayan, we have the sinus arrhythmia po. Pag sinabi nating sinus arrhythmia, ayan, irregular po ang rhythm natin dito pero normal ang heart rate ng patient. Tingnan po natin, oh. Normal ang heart rate mo pero irregular ang rhythm po natin. Tignan natin. See? Ayan, P wave, P wave, P wave. Tapos biglang, okay, nag-narrow bigla, no? Ayan. 'Di ba? Okay dito, the same sila ng distance, the same. Pero pag reach dito, guys, ba't parang hindi na the same? Ayan. Ba't parang hindi na the same? Kaya ang tawag natin, irregular na po ang pattern niya. Pero don't worry, kasi ang kanyang heart rate is still normal. So ang tawag natin doon, sinus arrhythmia. Now, next, we have the sinus tachycardia. Now, sir, ano ba ang reasons kung bakit may sinus tachycardia ang patient natin? So, we have the F. Number 1, if the patient has fever. Next, ang patient mo may fatigue. Next, aside from that, may fluid loss ang patient po natin. And then lastly, pag letter F, in pain ang patient mo. In pain ang patient natin. Guys, if the patient is in pain, expected talaga na mataas po ang heart rate ng patient natin. Leading to sinus tachycardia. Lalo na pag pain, patient to the cardiac pain kasi ang patient natin. Guys, let me remind you ulit that when we say pain po, this is a what? Ayan. Huwag mo siyang i-judge, no? Kasi yung iba sa atin, nag-i-inarte na naman to. Grabe ka, no? Huwag po siyang i-judge. Hindi naman ikaw magbabayad ng batay siya. So ganito, paano ba mag-give? Na those are verbal reports na pag mga subjective or verbal reports coming from the patient, ayan, you are in pain. I understand. On a scale of 1 to 10, how would you rate your pain? Okay po? Tapos sabi niya, 15. Sabi ko, ma'am, hindi ka nakikinig sa akin. Ang sabi ko, 1 to 10 lang. Hala, grabe siya. Toxic na nurse, Guys, wag naman ganun. Wag mo naman pagalitan. Meaning to say, kulang pa ang 10 sa pain na nararamdaman ng client nyo. Gusto niya i-exaggerate. Gusto niya 15. Okay, sige. You accept that na ilagay mo yan, di ba? Sa documentation nyo, na scale of 1 to 10, 15 ang sagot niya. So grabe, like sobrang intense ng pain niya. Pero yung iba kasi, ma'am, on a scale of 1 to 10, how would you rate your pain? Sabi niya 1. Kasi sanay na akong masaktan. Char, hugot si patient. Kahit ano daw pagsubok na, ayan, nalalagpasan naman na niya daw. Ikaw na si Wonder Woman na. So again we have the sinus tachycardia. Natatawa ako sa energy ko. Parang feeling ko hindi Sunday Parang feeling ko yung energy ko parang Monday na Monday, na. Tapos kayo, ang mga energy nyo, like pang Sunday talaga. Alam mo yung mga kaluluwa po natin ay nasa bed lang. Tas ako naman, kailangan kong mag-project na parang yes, energetic, gano'n. Ang hirap pong kumita ng pera, gano'n. We have the sinus tachycardia po Okay. Ayan. Now, pag sinabi po natin sinus tachycardia, yes, na it's above 100, pero less than 150 para sabihin natin sinus tachycardia. Kasi pag nag-150 na po tayo and above, that's already atrial tachycardia. All right? So we have the sinus tachycardia here. Now, for the sinus tachycardia, mali po yan ha, hindi po yan 180, but rather okay, up to 150 dapat. Kasi pag 150, okay, and above 151, atrial tachycardia na po yan. All right. Next po, ano ba yung mga causes ng sinus tachycardia po natin? So ito na yung kanina, pwede niyong picturean, 'di ba? Ayan, so kasama po yung mga kape. Kape. Yung mga addict sa kape dyan, 'di ba? Pero nangunguna na kasi yung mga fever, no, yung mga fluid loss, bleeding also can be a sign of tachycardia, especially for those who are working sa OR, alam na nila yan. Wait lang, ba't parang nag-tachycardia ang patient natin? Ba't parang tachycardic? So, chine-check agad niya ng mga OR, okay, nurses na, wait lang, i-check nga natin yung site niya. Yun. Nagbi-bleed pala si client kaya siya tachycardic in nature. Ayan, no? Syempre, ayan, fluid loss, okay, can lead to tachycardia. Yeah, na? Ito na yung mga okay, ano po, mga reasons, okay, or mga causes kung bakit may sinus tachycardia ang patient natin. Sige? So let's have okay, the moving ECG na po. Let's have the moving ECG. Start muna tayo sa pinaka first topic natin no, sir, the NSR. Okay? Now, guys, paano nga tayo mag-analyze? Mga na-discuss ko muna ha, sinus lang muna tayo. The heart rate is 70, so it's normal. The rhythm, the P is to P and R is to R, they are what? No? The same ang ano nila, ang distance. So the rhythm is regular. I can see P waves. They are clear and upright. Oops, sinus na agad yon. Followed by QRS, which is normal in nature. So therefore, the patient is having a normal sinus rhythm. Next. The heart rate is 38. The rhythm is regular. I can see P waves. They're clear and upright, followed by QRS, which is what? Na normal in nature. So guys, tignan mo naman, 38, less than 60. Tama po? Ayan, so anong tamang sagot dito? Sige nga, i-chat nyo nga sa chat box po natin. Ayan, try nating mag-exercise sa chat box. Sige nga. Ayan. I-type na po ang tamang sagot. Ayan. Ano ang tawag sa sa ECG reading na to? Yes, I am seeing sinus. Ayan, bradycardia. Guys, it's sinus bradycardia. Thank you po na Ma'am Saitus. Ayan. And then may mga nag-direct din sa akin na sinus, okay, bradycardia. Galing, no? Ayan, next po. Ayan, may napansin ka ba? 120, sir, pero hindi po siya lumagpas ng 150. So alam ko it's sinus eh. Tama? Sige nga, let's try. The heart rate of the patient is 120. Ay, ang galing. Na? The heart rate of the patient is 120. The rhythm is regular. I can see P waves. They are clear and upright, followed by QRS, which is normal in nature. So therefore, the patient is having what? It's sinus tachycardia. Galing-galing. Next po. Okay. Now, the heart rate is 76. Sir, it's normal. However, the rhythm here is abnormal. Ayun na. And then, the P wave pa rin is normal because it's clear and upright. Tapos, ang kanya, okay, QRS is normal also. So therefore, this is what? Sinus arrhythmia. Okay po? Normal ang heart rate, abnormal, okay, rhythm. Sige, let's have, okay, ano po, parang drill na, ayan, let's have a drill. Ipapakita ko yung running ECG, tas i-type nyo ang tamang sagot. Okay lang po? In a matter of 3 seconds only. Let's begin. Are you ready? Sige po. Okay, answers. Pa-type na lang po na sa group chat po natin. Ano kaya yan, guys? It's sinus what? It's sinus bradycardia. Next po. Ayan. So ano po ito, guys? This is your what? Sinus. And this is what? Sinus tachycardia. Okay. Next. Okay. So this is what? Your normal sinus rhythm. Or the what we call as the NSR. Ayan. Great. Thank you, Ma'am Sarah. And then lastly, sige nga, before our break po. So guys, this is what? Ayan, this is your ayan, sinus arrhythmia. Kasi normal ang heart rate mo. Yes, ma'am. Thank you po. Normal ang heart rate natin, pero irregular po ang rhythm natin. So it's sinus arrhythmia. Okay, let's have muna the 15-minute break na. And ma'am WePump, ma'am, staff po ng WePump, magbe-break muna tayo ng 15 minutes ha. Medyo pumapangit lang internet ko. Okay, usually ganito talaga yan pag mga 2 o'clock. Okay po? Ayan, sige, let's have the 15-minute break lang muna. And then I'll be playing videos po while we are on break. Sige?
Hello. Now I'm going to talk about one of my favorite topics, which is basic life support for cardiac arrest. So let's start off with a case scenario. We have a 58-year-old man. He's running along in a sporting event, and he suddenly drops, becoming pulseless and apneic. What do you want to do to save his life? We're going to talk about the most important interventions that you can perform right there on the scene that are most likely to improve his outcome. We're going to talk about why this happened physiologically, what might be going on with him, and we're going to talk about the supporting evidence that helps us know what the most effective interventions are. So what is cardiac arrest? The term cardiac arrest refers to the abrupt cessation of effective circulation. Basically, it means the heart is stopped. It encompasses a lot of different underlying diseases and conditions, but the final common pathway in each case is that the heart is not producing the effective circulation of blood to the body. So the primary cause of cardiac arrest, first and foremost, is coronary ischemia. The whole world over, that is the #1 cause. But there are other things that can lead to cardiac arrest as well, including cardiomyopathies, structural heart lesions such as valvular disease, electrical conduction abnormalities such as Brugada syndrome or other channelopathies, metabolic disturbances, particularly those in electrolytes, toxic ingestions. There are a number of poisonings that can produce cardiac arrest, and there are other non-cardiac conditions that can lead the heart to stop. When we look at the epidemiology of cardiac arrest, in the United States, we have about 500,000 arrests per year. Of those, about 60% occur outside of the hospital. And for out-of-hospital arrest, there's only about a 10% survival rate, although that number does go up to 30% for cases which are witnessed by bystanders and the victim receives rapid CPR. About 200,000 of these events, or about a little more than a third, occur inside of the hospital. And in the hospital, we have a 20% survival rate, which is double what we get outside of the hospital, but it's still really not great. Obviously, that survival is going to be affected by the etiology of the arrest, the hospital itself, how prepared it is to deal with high acuity events, and believe it or not, the time of day. As far as the epidemiology goes, the incidence of cardiac arrest increases linearly with age. So as you get older, you have a higher and higher risk of having an arrest. and 57%, or almost 2/3 of the patients, are men. When you look at the cardiac rhythm in patients with cardiac arrest, about a quarter have either ventricular fibrillation or ventricular tachycardia, which are known as the shockable rhythms. Among those patients, you have about a 30% survival rate. The remaining rhythms, which are pulseless electrical activity and asystole, only produce about a 10% survival rate. So there's a big difference in how likely you are to survive based on what type of rhythm your heart goes into at the time of arrest. Overall, shockable rhythms represent a minority of arrests, only about 25%, but 3/4 of patients who survive have shockable rhythms. So you are much, much more likely to survive a cardiac arrest if you have ventricular fibrillation or ventricular tachycardia rather than one of the other two arrest rhythms. When you see somebody in cardiac arrest, they are invariably 100% of the time unresponsive, pulseless, and most commonly apneic, although a few will have preserved agonal respirations or gasping. When you're evaluating an unresponsive patient, you want to always get help right away. Not every patient who's unresponsive is in cardiac arrest, but you should assume the worst case scenario. Assume that your patient is in cardiac arrest and that you need immediate backup. And even if your patient doesn't turn out to be in cardiac arrest, it's never a bad idea to get help because the things that make you unresponsive are never good. Once you have help on the way, the next question you want to ask yourself is, does this patient have a pulse? This is why in cardiac arrest, we don't use the old ABC mnemonic that we talked about in prior lectures to assess the patient. We use CAB, circulation first, because the first and most important question is whether or not your patient has a pulse. We want to check the pulse for a maximum of 10 seconds, always in the carotid. And if at the end of that time there either is no pulse or we have any question as to whether or not there's a pulse, we're going to go ahead and initiate CPR. Only after we've decided whether or not a pulse is present are we going to worry about airway and breathing. So while you're checking the pulse, you can look for clinical evidence of respiration. Again, sometimes you'll see agonal breathing or gasping, and rescuers often mistake this for normal breathing, but you should never see normal rhythmic breathing in a cardiac arrest. If you do, you should rethink whether or not your patient is really in cardiac arrest. So like I said, your most important question is whether a patient has a pulse. We're going to assess that by palpating the carotid pulse. The reason we go for the carotid is in shock, this is the last pulse to go. So patients who are hypotensive but still do have spontaneous circulation might lose their radial or their femoral pulses, but they're always going to keep their carotid pulse up until the last moments before they cease to have circulation. Once again, you get a max of 10 seconds. If you don't clearly detect a pulse in that time frame, start CPR. You're never going to hurt a patient by performing unnecessary CPR, but you will absolutely hurt people by withholding CPR when in fact they don't have spontaneous circulation.
Welcome to Lecture 8 in the series Introduction to Cardiology. In this series, we are going to consider one of the most serious problems that faces a cardiologist, the patient with heart failure. Heart failure is very common and increasingly common these days. It's because it is a common complication of older individuals, and of course, the older population is increasing throughout North America and Western Europe, as well as Asia. Heart failure is defined differently in different circumstances by different cardiologists, but basically it's an inability of the heart to pump enough blood to meet the demands of the body. In other words, if one exercises, one requires an increase in blood flow to the body, and if you can't do that, you may develop the symptoms of heart failure. As we're going to see, there are a number of compensatory mechanisms that get set off in heart failure, and some of them actually work to increase symptoms in these patients. The major issue here is that the heart has an inadequate or decreased cardiac output. Remember, cardiac output, that's stroke volume times heart rate. That is the amount of blood the heart puts out each beat times the heart rate. And in this setting, what you see is that the patient has an increase in blood volume because of compensatory mechanisms that work to correct the heart failure state. Unfortunately, this leads to fluid accumulation in the body and even edema, that is swelling in the body. This can also be associated with circulatory congestion, for example, in the lungs. So you have increased fluid in the lungs, so the patients are short of breath. And in addition, you may see patients being markedly fatigued because they're not getting adequate heart pumping. As I said before, it's a very common problem. There are more than 3 million patients in the United States with heart failure. There's a number of new patients presenting every year. And unfortunately, heart failure has a very poor prognosis, often a prognosis just as bad as many forms of cancer. Heart failure is more common in African Americans. And it's interesting that these patients seem to do better briefly when they're admitted to the hospital, but their long-term outlook is worse. Some of this may be because of lower socioeconomic conditions in many African Americans. The heart failure frequency in the U.S. has been increasing with an increasing population. A statistic I like to quote is that in the United States, in every 24-hour period, more people will become age 85 than will be born. So you can imagine if heart failure is a very common problem in the elderly, just as atrial fibrillation is a common problem in the elderly, both of these are what I call, quote, growth industries. And again, women tend to be a little less frequently affected by heart failure. Men is a little more common early on, but once we get into the geriatric population above 65 to 70, the amount is about the same. There are a number of factors that are referred to when we talk about heart failure, and you'll remember some of these factors from the basic lectures on heart function. Remember preload. Preload is filling of the heart, so that it's a manifestation of the size of the ventricle when it fills up. When you have increased blood volume, you increase the preload, that is the amount of volume that the heart has to squeeze out. This happens with some of the compensatory mechanisms that increase the blood volume, and consequently, preload may be increased in the heart. And what increased preload leads to is increased filling pressures in the ventricle during diastole, during the rest period. This leads to increased pressures in the ventricle during diastole, and those increased pressures are transmitted back to the lungs and even back to the rest of the body, leading to fluid accumulation in the tissues of the lung and the rest of the body. Afterload is the work of the heart. It's the resistance the ventricle feels when it is pumping out. This is usually due to resistance in the vascular system. You'll remember that from the basic lecture in cardiology. Increased peripheral vascular resistance leads to increased afterload, increased work of the heart. You can imagine that's not good in heart failure. And in fact, here's a clue. When we talk about therapy of heart failure, one of the things is to decrease afterload, to decrease the work of the ventricle and hope that it will recover from its depressed state. There are two forms of heart failure, systolic and diastolic. In other words, sometimes, let's take diastolic first, the ventricle squeezes all right, but it fails to relax normally. It relaxes slowly or in a stiffened manner, leading to increased pressure in there that gets transmitted throughout the circulation and leads to collection of fluid, as we talked about before, edema. Systolic heart failure is when the ventricle fails to squeeze well. That can happen, of course, with the patient who's had heart attacks, happens to patients with cardiomyopathy, heart muscle disease. And often, systolic heart failure is associated also with diastolic. So most patients with heart failure have both systolic and diastolic, but there is a whole group of patients, a minority, as you can see from the circle diagram here, who have pure diastolic heart failure. Interestingly, the long-term prognosis for diastolic heart failure is just as bad as for systolic heart failure. Diastolic heart failure tends to occur in older individuals, often with thickened heart muscle. Now, there are a number of compensatory mechanisms that the body sets off when it sees heart failure. Remember, I mentioned them just a few moments ago. What are the compensatory mechanisms? Well, let's think. Why would the body compensate for decreased cardiac output, for decreased pumping of the blood? The reason the body compensates is because it interprets heart failure as if there had been a hemorrhage, a blood loss, or dehydration. In other words, the reduced pumping ability, the body interprets as, oh, there's a lack of blood from a hemorrhage, or there's a lack of fluid in the circulation because of dehydration. And it sets off a whole bunch of compensatory mechanisms aimed at holding on to fluid, water, and salt. Unfortunately, this is exactly the opposite of what we would want, because in holding on to fluid, you actually create the setting where patients put some of that fluid into the tissues, both in the legs as edema or in the lung as pulmonary edema. So the activation of the neurohumeral system, that is central nervous system initiated activity to correct the heart failure situation, actually makes the situation worse. These systems work great if there's dehydration, you're caught in the desert without water. They work great if there's a hemorrhage, you've been cut somewhere, or you're bleeding from an ulcer in your stomach. But they work, unfortunately, in a negative manner in the patient with heart failure. Let's just talk for a moment about why these compensatory mechanisms work. They work because of something I mentioned before, Starling's law, the so-called rubber band law of the heart. The more you fill it, the more it contracts. So what the compensatory mechanisms are trying to do is to increase the filling of the heart so it will squeeze more. As I've said, unfortunately, that leads to elevated pressures that back up in the system and result in edema. But the rubber band law of the heart says that the force of contraction is related to how much you stretch the heart muscle cells, and this increases contractility. So you see why the body is trying to increase the pumping ability of the heart, and this works fine if it's a hemorrhage or dehydration, but it doesn't work well when the patient has heart failure. So remember, stroke volume is the number of cubic centimeters that the heart puts out with each time it squeezes, times heart rate, that's cardiac output. So when we have a reduction in stroke volume because the heart has been injured, sometimes you'll even see the heart rate go up because the central nervous system says, oh, cardiac output is falling. We have to increase the heart rate. We have to increase our ability to hold on to salt and water and increase the blood volume and use the Starling law to increase the contractility of the heart. Again, unfortunately, it's not the right setting for that, and this leads to overfilling of the circulation, increased pressures in the circulation, and increased fluid getting out into the lungs and into the tissues. So the central factor in heart failure, of course, is depression of the heart muscle, at least for systolic heart failure. But also in diastolic heart failure, the heart is supposed to actively relax, and there's also depression of that. But the commonest form of heart failure, as you've seen in the previous slide, was systolic, and it is usually because there's been some injury to the heart muscle, most commonly from ischemic or coronary artery disease with heart attacks. And again, we've talked about the compensatory mechanisms. Here are the compensatory mechanisms listed. First of all, they're initiated by the central nervous system. One of them is a signal that's sent to the kidneys and that the kidney actually does on its own. The kidney is the regulator of the blood.
Hanggang doon tayo sa heart failure natin. And then i-continue po natin siya tomorrow. Ayan, para diretso tayo sa ating topics. Now, for before we end, let me discuss muna the atrial problems, such as yung mga atrial tachycardia. Ay, wait lang. Matanong ko lang, andito na po ba lahat? Ayan. Can I show some heart reactions po? Ayan, para at least alam ko kung may nakikinig pa ba or wala na. Ayan, no, Korean. Ayun. Andyan naman pala sila eh. Okay, thank you, ma'am. Yes, pwede na po kayong in case lang. Hi. Ayan, sige po. So, we are done na with the sinus tachycardia. We're done na with the normal sinus rhythm. Diba, the sinus bradycardia, and then we are done na po sa sinus arrhythmia po natin. Now, let's proceed na sa ating atrial tachycardia. Guys, when we say atrial tachycardia, ang pathognomonic sign talaga nito, or the most outstanding sign, if the client's heart rate reaches na po 170. Ito yan Tapos if that becomes irregular, ayan, 170 ang heart rate mo, tapos regular, sorry. Ayan, heart rate is 170, tapos it's regular in nature. However, kasi ang P-wave natin the P-wave po talaga. Ito P-wave is buried, preceding to T-wave. Yun ang pinaka-problem natin. Sir, bakit? Dahil sa sobrang gutom daw ng T, kinain ang P mo. Ulitin ko ha. Dahil gutom si T, kinain si P. Kaya parang hindi ka na sure, wait lang. Ano to, P2 or T? Ayan, tignan natin ha. Ayan, i-justify ko yung sinabi ko. So this is your P wave. Ayan. To a normal, let's say, ang patient mo nagkaroon ng sinus tachycardia. Ibang-iba si sinus, ibang-iba si atrial. Why? Ito sinus tachycardia to. P, 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 P. So meaning ito si P, ito si P, ito si P, ito si P. Ito si P. So sino tong red, sir? Wait lang. Ito-draw ko red, 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 red. Okay, ito si T, ito si T, ito si T, ito si T at saka ito si T. Tama po? So meaning obvious, sir, na clear and upright ang P-wave natin kasi nakikita ko din si T-wave. However, pag nag-atrial tachycardia na tayo, hala, ano to? T or P? T or P? T or P? T or P? So meaning it's unclear. Or basically, it's buried in nature. At pag sinabi kong buried, it's buried preceding to T-wave. Meaning, kinain ng T-wave mo, ang P-wave mo. So, hindi na tayo sure if it's your P-wave or T-wave. Okay? So, meaning to say, this is the atrial tachycardia. Now, when we say atrial tachycardia, other term for atrial tachycardia will be the SVT, or the supraventricular tachycardia, or commonly known as the narrow complex. The narrow complex, tachycardia. So pag sinabi nating narrow complex tachycardia, ayan, it's your, the what? No, the SVT, or the atrial tachycardia. Sige, kopyahin niyo muna. Ako, pinicturan ko lang din. Para may proof ako na nagturo ako ngayon. Para sabihin nila na okay, busy pala si sir. Para sabihin nila, teacher of the year to si sir. Kasi kahit Sunday, may trabaho po siya. Tapos tomorrow kasi, about to end na po yung semester po namin. So case analysis na sila. So totoksokin ko sila sa pathophysio. Tapos ang binigay ko sa kanila ng mga ng mga case analysis, yung mga forte ko pa sa GI, tapos sa heart, tapos sa liver din. Syempre, magbigay ka na lang ng dapat may malu-learn din yung estudyante. Dapat yung forte mo din. Kasi naman baka parehas kaming naghihintayan lang ng mga tamang sagot. Kasi parang, okay, parang ako din pala nakikinig sa kanila para maka-learn din. Syempre ayaw ko yung ganon. Nag-teacher ka pa. Although kasi pag teacher din kasi, we need to learn din from our students. Tama? Yeah, kasi I do believe in the saying na, ayan, once you stop learning, you stop growing. Kaya I really admire na for those na nag-aaral, 'di ba? Nagma-masteral, no? Kasi learning kasi never stops Like never talaga siya magsa-stop. Magko-continue po siya kasi from then on, 'di ba? Every second din kasi na may mga bago, 'di ba? May mga updates, no? So I hope naman mas ganado pa tayo na mag-attend pa ng mga ibang trainings, 'di ba? Kahit online ngayon, you grab certificates lang, walang problems. nakakapagod, actual pa. Kung no, sa online lang, pwede ka namang char. Kasi pag actual, kailangan tapos sa pagkabili ko ng TV, yung pamangkin ko, wala. Na puro Cocomelon lang talagang napapanood namin. Imbes na 'di ba mga action, mga love story, wala. Puro Cocomelon. Puro na memorize ko na yung mga kanta ni Cocomelon. Pag yan si Cocomelon nakita ko talaga, isi-CPR ko talaga agad yan. Kahit conscious siya. Galit kay Cocomelon eh. And we have the atrial tachycardia po. For the atrial tachycardia guys, na protocol po natin ngayon, if the patient is symptomatic, na ito po ang ginagawa sa kanya. Or basically, pag stable po ang patient natin. So, pwedeng mag-oxygen if indicated. Careful lang tayo guys. This is a fun fact regarding oxygen. Oxygen po is not combustible alone. 'Di ba? Pag si oxygen alone is not combustible, it only supports combustion. When there's fire and then there's oxygen, sabog talaga. Pero pag mismo si oxygen lang, no, it's not combustible. Pero pag kasama na ng iba, it will support combustion. Next, we have the vagal maneuvers also. Pag sinabi po nating vagal maneuvers, yung mga carotid sinus massage, ito yon. It's really carotid. Ayan, sinus massage. Ayan, or the CSM. Para pa lang nag 3 hours and 30 minutes tayo, no? Kasi nag-start tayo ng 12:30. Tama po ba? Yeah, na-realize ko lang. Sabi ko, nag-start pala kami ng 12:30. Baka yung iba siguro hindi naganahan kasi 12:30 nag-start. Usually kasi 'di ba pag afternoon session usually 1 na excited akong bumalik eh. Bakit ba? And we have the vagal maneuvers po. You guys, your carotid sinus massage, you're going to massage the carotid artery for ilang seconds po? For 10 seconds only. And then you make sure na isang carotid artery lang. Kasi ganito anong mangyayari. Times 2 po ang pagbaba ng heart rate ng client. Imbes na ma-okay ang client, biglang namatay ang patient. Okay po? Ayan. And then alam niyo ba kung sino lang ang pwedeng mag-perform ng carotid sinus massage? Only yung ating mga lovely physicians po. Only the doctors lang po ang allowed, okay, na mag-perform ng carotid sinus massage. Next, we have the adenosine po. Yes, this will always be the drug of choice. Ayan. Next, Sunday po, i-discuss ko sila thoroughly. And then we have the calcium channel and then we have the beta blockers also. Okay po. Ayan, next. Sige. So, these are, the vagal maneuvers po natin. Ima-massage po natin yung carotid artery natin for about 10 seconds. So, we need to put pressure dapat. Na? Now, if ever guys, kung 50 years old and above ang patient po natin, no need for you to massage the patient. Why? Kasi pag 50 years old po, medyo matagal na sa mundong ito, tapos ima-massage mo yan, yung mga fat deposits po sa kanilang neck, baka ma-dislodge po yan. From thrombus at baka maging embolus. At pag naging embolus po yan, that leads to stroke. 'Di ba? So katakot 'yon, 'di ba? Ayan, so ganito. If ever guys, no, kung 50 years old ang patient natin, 50 and above, you suggest coughing. Coughing for more than 10 times. Why? Your coughing also is also a vagal maneuver kasi yan. Napansin niyo ba na pag umubo ka, diretso, tas parang feeling mo parang wait lang, ba't parang nahilo ako, friend? Kasi there was a vagal stimulation eh. 'Di ba? Pag sinabi nating vagus nerve, pag na-stimulate po ang vagus nerve mo, na anong mangyayari? Babagal po ang pagtibok ng puso po natin. So it will result to what? No? Sa patient natin dito, 150, no? Ang heart rate ng patient. pababagalin natin by simply having the vagal. Kaya siya tinawag na vagal maneuver kasi once stimulated ng tubol is your hardened stool, di ba? Constipated. Ang igit naman, syempre alam natin yung igit, di ba? Ito yung utot na may sabit. Akala mo, no? Umutot ka, yun pala may something na igit ang tawag doon, na ayan. So guys, ganun po mag-perform ng vagal maneuvers po natin. Ulitin ko. Pag greater than, okay, 50 years old, encourage the patient to cough. Pero pag less than 50 years old, you perform carotid sinus massage. Pero doctors lang po ang allowed doon. Bawal po ang nurses. Alright? Ayan. So again, ilang seconds nga tayo mag-massage? 10 seconds. So 1,000. Ako hindi ko i-massage siya. Baka kasi mag-bradycardia ako dito. Tapos ako lang isa. Diyos ko, katakot. O kunwari, 1,000, 2,000, 3,000, 1,000, 4,000, 5,000, 6,000, up to 10,000. So, magulat ka na lang, biglang bumagal pa ang pagtibok ng puso ng patient po natin. Which is okay, kasi nga may tachycardia si patient. Now, ito yon. So, prior na i-massage po, we need to make sure na it's really your carotid artery. If that is pulsating po, di ba, pag may pulso po siya, then most likely doon talaga tayo magmamassage, no? If you are a doctor. Kasi si doctor lang po ang pwedeng magmassage. Next topic, ayan, we have the atrial fibrillation. Ayan, atrial fibrillation. Guys, pag sinabi po natin atrial fibrillation, alam niyo ba ang end complication nito? Nakakatakot pong atrial fibrillation. Why? Because this leads to stroke. Nagkakaroon po ng stroke ang patient natin pag nagkakaroon ng tinatawag na atrial fibrillation. Why? Ang tawag ko dito, this is the irregularly irregular. Grabe oh. Kung may irregular na, siya na talaga ang irregularly irregular. Okay po? And then this is basically chaotic in nature. Kaya siya tinawag na atrial fibrillation. Kasi ang makikita mo guys, di ba meron tayong ventricular fibrillation? Tama? Meron din tayo, ito this is the atrial fibrillation. Irregularly irregular, nakakatakot to. Why? Aabot kasi up to 400 to 600 beats per minute ang heart rate ng patient. Kaya grabe po yung mga ejections ng mga blood leading to dysrhythmia. Grabe ang dysrhythmia leading to what? The development, diba, from thrombus maging embolus, no? So nagkakaroon talaga ng stroke ang patient po natin. Now, speaking of stroke, guys, how are we going to determine ngayon? Diba? Paano natin malalaman kung may stroke? What are the warning signs? What are the warning signs of stroke? Diba dati kasi it's fast. Tama po? Dati it's fast, according to AHA. Pero ngayon, be fast na po siya. Be fast. Hindi be fat ha, sabi ko be fast. Iba ang be fat sa be fast. Okay? Sige nga, sabay-sabay tayo. Everybody say be fast. Again, everybody say be fast.
Be fast.
Ayan, thank you ma'am. Ayan, we have our letter B, the balance of the patient. Pag na-outbalance na po, okay, outbalance na ang client natin, biglang natumba, those are warning signs of stroke. Next, lalo na kung kagagaling lang ng buffet, dahil sa katakawan te, mukbang pa. Sige ha, mukbang pa. Ako kasi, I don't eat rice talaga. I don't eat rice like for almost 5 years, I don't eat rice. Pero I eat pancit, like bilao. At nakakaubos ako ng isang loaf, no, ng gardenia. whatever you call it, na like grabe ako mag-carbo. Hindi nga ako nagra-rice, parang nagka-carbo. Yeah, na-try ko na din na hindi po mag-soft drinks for 4 years. Pero na-break lang nung na-break lang talaga nung New Year. Nag-soft drinks na ako. Kasi parang feeling ko nade-depress ako pag dine-deprive ko yung sarili ko. Hindi na nga ako nag-rice, hindi pa ako nag-soft drinks, tas diabetic ka pa. Kasi pag diabetic talaga, grabe yung uhaw. 'Di ba? Nauuhaw ka. Kahit nagme-meds ka, nauuhaw ka pa rin. Okay, sabi ko, Diyos ko, ayan, yung tipong, yan, nagkasakit ka na nga, tapos parang feeling mo pa, de-deprive mo pa yung sarili mo. Sabi ko, baka mature ba ako ito sa depression, di ba? Kaya sabi ko, sige na nga lang, inom na nga lang ako ng soft drinks. Pero royal muna. Ayoko muna ng Coke. Natatakot ako, char. Parehas lang naman ni soft drinks, no? Ayan, basta hindi ako nagra-rice. Yun yung kaya kong ipagmalaki. For almost 5 years na. Parang lagpas na nga 5 years eh. Like never talaga akong kumain ng rice. Nung nagra-rice ako guys, ang timbang ko 100 kilos. Pero nung hindi na po ako nag-rice, 112. Baliktad po ang nangyari. So dapat pala siguro nag-rice na lang ako. Kasi mas lalo akong tumaba. No? Ay, ang weird. Siguro kailangan ko talaga mag-exercise. So we have our letter E, the eyes. Now the vision of the patient. So there will be a vision loss or loss of vision. There will be loss of vision. Ayan, no? Pwedeng temporary or pwedeng permanent po. Basta biglang natumba ang client po natin. Next, we have the facial drooping. The facial droop or biglang nagsag, 'di ba? Biglang bumaba, no? Ang left side ng client po natin, left part or left side ng face niya. That's where the facial droop. Naalala ko dati, akala ko talaga na-stroke ako dati. I suffered from facial drooping. Yun pala, Bell's palsy. Diyos ko, kabang-kaba lang talaga ako. Siyempre, dinala ako sa hospital, no? Tapos nakita ko pa yung tito ko doon na stroke. Sabi ko, ay, hereditary nga. Familial nga, 'di ba? Diyos ko, grabe yung predisposing. At first, in denial ako. Sabi ko, shit, hindi to stroke. Pero nandun na yung tito ko eh. Na-stroke din siya. Timing, nandun kami dalawa sa ER. Sabi ko, Lord, sana hindi to stroke, Lord. No, yun pala, yan. Na-diagnose ako having Bell's palsy. Pero nerve naman yung naapektuhan sa akin. Nakakatakot. Next, we have the arm drifting. Ayan, arm. Ayan, drifting po. Pag sinabi nating arm drifting, ganyan na. Tapos biglang bumaba na yung isang arm ni client kasi nawalan po siya ng strength, ng arm strength. So meaning, okay, paralyzed nga siya. Na? So baka na-stroke nga to. Baka lang muna. Next, we have the speech, the slurred speech. Ayan, when I say slurred speech po, sa States kasi guys, na ang pinapabanggit nila, ayan, repeat after me, you can teach old dogs new tricks. Pag sinabi ng client mo, you can teach old dog new tricks. Ay, may slurring of speech na ang patient po natin. So if may slurring of speech na, warning signs of stroke. Pero pag sinabi ng client mo, ma'am, or let's say, sir, repeat after me. You can teach old dogs new tricks. Sabi ng client mo, you can teach old dogs new tricks. Bayot si patient. Charot. So, ayun po, no? Guys, ito nangyayari to ha. Nangyayari to sa 911. Sorry. Nangyayari talaga to sa may mga emergency cases na ganito. Ma'am, repeat after me. You can teach old dogs new tricks. Sabi ng client po, new tricks. Guys, iba po ang ngongo sa na-stroke. Utang na loob. Malalaman po natin yan. Baka sabihin mo, ay, na-stroke to si ma'am. Ala. Ay guys, ngongo lang po si ma'am. Hindi po siya na-stroke ha. Iba po ang ngongo sa na-stroke. Utang na loob. Kasi meron akong friend na nadala sa ER eh. Alam ko naman talagang ngongo yun eh, no? Kasi sabi ng isang nurse doon, na-stroke to. Diyos ko, sabi ko, ay, friend ko po siya, hindi po siya na-stroke. Ngongo po siya. pero nurse po siya, nurse siya na ngongo. Sorry. Pero wag ka. Yun lang yung ngongo na nurse. Pero nasa Canada na. #1 nurse po sa Canada sa isang hospital doon. At ang yaman niya na po ngayon. No? Kaya amazing. Wala sinabi na sana ngongo na lang din ako. Pero happy ako na friend niya ako at friend ko siya. Na? Yeah. Nakaka-happy, nakaka-proud na. Next guys, if ever kung meron na tayong mga BFAST like the balance, outbalance, the loss of vision, facial droop, no, arm drifting, slurred speech, and then this is the time to call 911. Time to call. Okay, 911 na po tayo. Magda-dial na po tayo ng numbers. Okay po? So that's for your atrial fibrillation. So papakita ko kung ano yung itsura ng atrial fibrillation later ha. Ayan. Sir, i-discuss natin si atrial flutter. Mamaya, i-discuss natin kung ano yung itsura. For the atrial flutter po, this is very common. Yung sinasabi natin the perfect sawtooth. When I say perfect sawtooth, guys, are you familiar with lagare? Di ba pag may sinasabi tayong lagare, 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 okay, perfect sawtooth. Na perfect lagare siya na tooth. Mako-compare mo si atrial fibrillation at si atrial flutter. Kasi sa atrial fibrillation, masyado siyang magulo. Para siyang sawtooth pa rin, pero sobrang gulo. Pero pag sobrang parang regular na siya, up to the point na perfect sawtooth siya, it's the atrial flutter. 'Di ba? Ito na lamang talaga yung dalawa, 'di ba, na kino-compare. Sino si atrial fibrillation? Sino si atrial flutter? Basta kung magulo ng ngipin, it's the atrial fibrillation. Pero pag close to perfect sawtooth, it's the atrial flutter. Okay, or the flutter or the flur. Now, pag sinabi nating atrial flutter, sir, yes, of course, aabot po yan ng mga 350 to 450 bits. Kanina kasi 600 bits talaga eh. Ito, up to 450 bits po per minute. Now, ano ba ang mga itsura nila, sir? Ayan, may mas clear pa ako na itsura dyan. Wait lang ha. Wait lang, i-ano ko lang. Gawin ko tong, for a while. Gawin ko tong 390. Tapos ito, gawin kong 472. Okay. Okay. So ganito yan. In case guys na makita nyo na umabot na po tayo or let's say greater than 150, di ba atrial na yan eh. Sobrang tataas no, like 500, di ba? Kaya magulat ka, oy, wait lang. Ba't parang nag-400 na to, nag-600, nag-550, na? Alam ko na yan. Atrial na yan. Guys, huwag kang kabahan like, sir, ano nangyari sa ventricular? Kasi ang ventricular kasi, usually wala ng mga pulso yan. Okay po? Pag atrial kasi, no? Like 350, 390, up to 600. Ayan. And then pag ganito pang itsura na nakikita po natin, take note the heart rate is 390. The rhythm is chaotic in nature. I can see fibrillatory waves. Ayun na yung term eh. Fibrillatory waves. So meaning to say, pag sinabi natin fibrillatory waves, atrial fibrillation to. So again guys, on your screen po, these are what we call as the atrial fibrillation. The irregular po. Now, ipapakita po natin perfect sawtooth. Okay po. Ayan, the heart rate is 472. The rhythm is more regular as compared kanina. I can see flutter waves. Di ba para siyang McDo? Anong i-order mo sa McDo? Ede flur, ede flutter. Di ba? Napansin niyo yung mga waves niya? Parang McDo, parang letter M, na? Parang sawtooth talaga siya or ngipin ng mga lagare. Di ba? So this is, a best example of your what? No, atrial, flutter. Okay po? Your perfect sawtooth. Now, before I'll end, ipakita ko din si SVT. Alright. Now, ano nga yung mnemonic na ano nga yung pathognomonic sign natin for SVT? If the heart rate is what? Above 150 and okay, the most outstanding sign will be 170 na heart rate. And then the rhythm is regular. There's no problem sa rhythm. However, tignan mo ang kanyang P wave. Ay, the P wave, sir, is unclear. And it's buried. I'm not sure if it's P or T. Ang sure ako, kinain siya ng T wave. Ayan, na followed by QRS, which is narrowed in nature. So therefore, okay, this is an example of an atrial tachycardia, SVT, or narrow complex tachycardia. Okay po? Sige nga, let's try. Now let's try. Before we end po, i-try nyong i-type ha kung ano yung mga nakikita po natin and sagutan po natin. Let's begin. Guys, what's this? This is your what? Your atrial flutter. Ayan. Next, what's this? Guys, what's that? That's your atrial fibrillation. Okay po? Next, what's this? Guys, ano nga yan? That's your the SVT or the atrial tachycardia or the supraventricular tachycardia. All right, guys, thank you for today, no? And thank you for this afternoon session na andyan kayo at andito din ako. Kahit malayo man tayo, para continuous pa rin yung learning po natin, na? And I really admire you, na? And for those kasi, I really understand na may mga work kasi yung iba pero kailangan po nilang certificate, kaya yung iba they ask for the recording. Okay? Ayan, so we pump, ma'am. Ayan na, wala na naman sila. Ma'am. Ma'am. Ma'am, we pump. Ma'am. Pati ba naman sila? Wala din. Tawagan ko, guys. Ma'am? Ma'am? Ma'am, we pump. Ay, yes, ma'am. Tinatawag ko kayo sa ma'am? Sa Zoom room. Ma'am, we pump.
Yes po.
Ay, yes, ma'am. Ay, yes, ma'am. Hello po. Ma'am, tapos na po ako, ma'am, na for my session today. And then we'll see you na lang sa next Sunday.
Okay po, Sir Mark.
Okay, ma'am. So bye na po, no? Bye for